Management of deaf child. Who are deaf children, and why should they be identified early? Children with profound, greater than 90 decibel hearing loss or total deafness fail to develop speech and have often been termed as deaf and mute, or deaf and dumb. However, these children have no defect in their speech-producing apparatus. The main defect is deafness. They have never heard speech and therefore do not develop it. In lesser degrees of hearing loss, speech does develop, but it is defective. The period from birth to 5 years of life is critical for the development of speech and language. Therefore, there is need for early identification and of hearing loss and early rehabilitation in infants and children. It was observed that children whose hearing loss was observed and managed before 6 months of age had higher scores of vocabulary, better expressive and comprehensive language skills than those diagnosed and managed after 6 months of age, emphasizing the importance of early identification and treatment. Assessment of auditory function in neonates, infants, and children demands special techniques. A. Screening procedures. They are employed to test hearing in high-risk infants and are based on infants' behavioral response to the sound signal. Arousal test. A high-frequency narrow-band noise is presented for 2 seconds to the infant when he is in light sleep. A normal hearing infant can be aroused twice when 3 such stimuli are presented to him. Auditory response cradle is a screening device for newborns where baby is placed in a cradle and his behavior, including trunk and limb movement, head jerk, and respiration in response to auditory stimulation, are monitored by transducers. It can screen babies with moderate, severe, or profound hearing loss. B. Behavior observation audiometry. Auditory signal presented to an infant produces a change in behavior. In other words, alerting, cessation of an activity, widening of eyes, or facial grimacing. Moro's reflex is one of them and consists of sudden movements of limbs and extension of head in response to sound of 80 to 90 decibels. In cochleopalpable reflex, the child responds by a blink to a loud sound. In cessation reflex, an infant stops activity or starts crying in response to a sound of 90 decibel. C. Distraction techniques are used in children 6 to 7 months old. The child at this age turns his head to locate the source of sound. In this test, the child is seated in his mother's lap. An assistant distracts the child's attention while the examiner produces a sound from behind or from the side to see if the child tries to locate it. D. Conditioning techniques. Examples of this technique include play audiometry. The child is conditioned to perform act such as putting a plastic block in a bucket each time the child hears a sound signal. Each correct performance of the act is reinforced with praise, encouragement, or reward. Speech audiometry. The child is asked to repeat the names of certain objects or to point them out on the pictures. The voice can be gradually lowered. In this way, hearing level and speech discrimination can be tested. The test can also be used to examine the child's expressive ability when he is asked to name the toys like horse, duck, or objects like cup, plate, etc. E. Objective tests. These tests are ideal for hearing assessment in children as they give results without the need of cooperation of child. Names of objective tests include 1. Evoked response audiometry. 2. Autoacoustic emissions. 3. Impedance audiometry. Management of deaf child. It is essential to know the degree and type of hearing loss. Aims of rehabilitation of any hearing-impaired child are development of speech and language, adjustment in society, and useful employment in a vocation. 1. Parental guidance. It is a great emotional shock for parents to learn that their child is deaf. They should be dealt with sympathetically so as to accept the child. They should be told of child's disability and how to care for it. Rehabilitation of the deaf demands a lot from parents. Care and periodic replacement of hearing aid, change of ear molds as child grows, follow-up visits for reevaluation, education at home, and the selection of vocation. 2. Hearing aids. Most deaf children have a small but useful port ion of residual hearing, which can be exploited by amplification of sound. Hearing aids should be prescribed as early as possible. If necessary, binaural aids, one for each ear, can be used. Hearing aids help to develop lip reading also. 3. Development of speech and language. Communication is a two-way process, depending on the receptive and expressive skills. Reception of information is through visual, auditory, or tactile faculties, which expression is through oral or written speech, or the manual sign language. In the hearing impaired, auditory faculty is poor or totally absent. Thus, for proper communication, there is need either to improve hearing through amplification of the residual hearing or cochlear implants, and in the absence of feasibility of developing the auditory faculty, to develop visual or tactile means of communication. A. Auditory oral communication. This is the method used by a normal person and is the best way of communication. In the deaf, it can be used in those with moderate to severe hearing loss or those who are postlingually deaf. Hearing aids are provided to augment auditory reception. At the same time, training is also imparted in speech reading. In other words, to read movements of lips, face, and natural gestures of hand and body. Expressive skill is encouraged through oral speech. B. Manual communication. It makes use of the sign language. C. Total communication. It uses all modalities of sensory input. In other words, auditory, visual, etc. Such children are taught to develop oral speech, lip reading, and sign language. All children with prelingual severe to profound deafness should undergo training in this form of communication. 4. Education of the deaf. There are residential and day schools for the deaf. Some deaf children with moderate hearing loss can be integrated into schools for the normal children with preferential seating in the class, giving them benches closer to teachers so that they can hear the teacher louder. 5. Vocational guidance. The deaf are sincere and good workers. Given the opportunity, commensurate with their ability, they can be usefully employed in several vocations.